What is the length of stay for Addict Rehab Center.com services? The length of stay for Addict Rehab Center.com services varies depending on the individual's medical needs, the severity of their condition, and the type of rehabilitation services required. Some patients may require a shorter stay of a few days or weeks, while others may need a longer stay of several months. The length of stay will also depend on the patient's progress and ability to meet their rehabilitation goals. What type of Addict Rehab Center.com services do you offer? Addict Rehab Center.com services can include physical therapy, occupational therapy, speech therapy, and other types of rehabilitation services. The specific services offered will depend on the rehabilitation center and the individual's needs. Some rehabilitation centers may offer specialized services, such as aqua therapy, or rehabilitation for specific conditions, such as stroke rehabilitation. What is the average daily therapy session length for patients? The average daily therapy session length can vary, but typically a therapy session can last between 30 to 60 minutes. The frequency and length of therapy sessions will depend on the patient's needs and progress. The rehabilitation team will work with the patient to determine the best plan for their individual needs. Are there any limits to the number of therapy sessions a patient can receive? The number of therapy sessions a patient can receive will depend on the rehabilitation center and their individual treatment plan. Some rehabilitation centers may have limits on the number of therapy sessions per day or per week, while others may allow for a more flexible schedule. The Addict Rehab Center.com team will work with the patient to determine the best plan for their needs. What is the staff-to-patient ratio for inpatient rehabilitation services? The staff-to-patient ratio for inpatient rehabilitation services will vary depending on the rehabilitation center. Some rehabilitation centers may have a higher staff-to-patient ratio to ensure that patients receive the individual attention and care they need, while others may have a lower ratio to maintain cost-effectiveness. The staff-to-patient ratio will also depend on the type of rehabilitation services being provided and the patient's needs. What qualifications do rehabilitation therapists have? The qualifications of rehabilitation therapists can vary, but most rehabilitation centers employ therapists with a minimum of a master's degree in physical therapy, occupational therapy, or speech therapy. Some rehabilitation centers may also employ therapists with additional certifications or specializations in certain areas, such as orthopedic rehabilitation or geriatric rehabilitation. Are there any specialized rehabilitation programs or services offered? Specialized rehabilitation programs or services may include rehabilitation for specific conditions, such as stroke rehabilitation, spinal cord injury rehabilitation, or traumatic brain injury rehabilitation. Some rehabilitation centers may also offer specialized services, such as aqua therapy or music therapy. What is the Addict Rehab Center.com team's approach to care and treatment? Addict Rehab Center.com team's approach to care and treatment will vary depending on the rehabilitation center, but most rehabilitation centers employ a holistic, patient-centered approach. This means that the rehabilitation team will work with the patient to determine their individual needs and goals and will design a treatment plan that addresses their physical, mental, and emotional needs. How does the rehabilitation team determine a patient's treatment plan? The rehabilitation team will determine a patient's treatment plan through a comprehensive evaluation of the patient's medical history, current condition, and rehabilitation goals. The rehabilitation team will also take into consideration any special needs or conditions the patient may have. The treatment plan will be designed to help the patient meet their rehabilitation goals and will be reviewed and updated as needed throughout their stay. What types of medical equipment and technology do you use in rehabilitation? The types of medical equipment and technology used in rehabilitation can vary depending on the rehabilitation center and the patient's needs. Some common types of equipment and technology used in rehabilitation include exercise equipment, electrotherapy equipment, and assistive devices, such as walkers or crutches. The focus on preventative rehabilitation measures will depend on the rehabilitation center and the patient's needs. Some rehabilitation centers may offer preventative rehabilitation services, such as strength training or balance training, to help prevent future injury or disability. Can family members or caregivers participate in therapy sessions? Family members or caregivers may be able to participate in therapy sessions, depending on the rehabilitation center and the patient's needs. Some rehabilitation centers may allow family members or caregivers to observe therapy sessions or participate in certain exercises with the patient. What is the discharge planning process like for inpatient rehabilitation services? The discharge planning process for inpatient rehabilitation services will involve a comprehensive evaluation of the patient's progress and needs. The rehabilitation team will work with the patient and their family to determine the best plan for continuing their rehabilitation after discharge, which may include follow-up appointments, home rehabilitation, or referral to an outpatient rehabilitation center. Are there any aftercare or follow-up services offered by Addict rehabilitation.com? Aftercare or follow-up services may be offered, depending on the rehabilitation center. These services may include follow-up appointments with the rehabilitation team. How is pain management addressed during rehabilitation? Pain management during rehabilitation will depend on the rehabilitation center and the patient's needs. The rehabilitation team may use a combination of techniques, such as medication, physical therapy, and alternative therapies, to manage a patient's pain during rehabilitation. How is communication and coordination between different healthcare providers ensured? Providers are crucial to ensure that the patient receives the best possible care. The Addict rehabilitation.com team will communicate regularly with the patient's primary healthcare provider, as well as any specialists involved in the patient's care, to ensure that everyone is on the same page and that the patient's rehabilitation is going smoothly. How is the Addict rehabilitation.com team involved in the discharge process and transition to home or another facility? The Addict rehabilitation.com team will be heavily involved in the discharge process and transition to home or another facility.